Well, Melissa, welcome to our practice today.
Hi.
We appreciate you doing this interview to help share with other people the experiences that you've had and things that have happened in your life. Melissa had a front tooth fixed recently, just about a week ago, and it was rotated. We did some composite bonding, easy to do in one appointment, and we want you to share with us, first of all, how was your life before this was happening, and I understand a lot of the great things have happened since, only in the past week. Can you share that with us?
Sure. Well, see, before I didn't have as much self-confidence. I didn't smile at all. I didn't talk ever with my mouth open. So, it made me feel really uncomfortable. And you can notice when people did talk to me, they always looked down at my tooth, and they always noticed that. And so I could see it right away. And then it made me feel more uncomfortable, so I didn't want to talk to anybody anymore. So it's now, since I've had it change, I talk to people. I talk to random people on the streets. I smile all the time. It just makes me want to get up and do my hair and do my makeup and get dressed in the morning and feel good about myself, and then just go on with things I had for the future, hopes and dreams, like this casting thing that I've done now. I put in headshots and stuff to do a casting thing that I tried to do when I was 17 years old and didn't have the self-confidence because of my crooked tooth, and now I have a call back and they want to meet with me on Friday to see about doing commercials and things like that, stuff that I've always dreamed about doing and I could never do. So it really has just changed, ultimately, everything for me.
Yeah. Now, you were saying that you held your hand in front of your mouth.
Yeah, when I would smile and everything, I would talk like this, or I would cover it, so that nobody could see, with my upper lip, and then that was just a natural thing to do all the time. And so it's been a really hard chore to try and break out of, covering my mouth, and learning how to smile or talk with my mouth open. Yeah.
So what are some of the things that people have said specifically?
Right away, to some of them who interacted with me daily, it was a big, they were like, you do this fixed, when did that happen? And so then I get to explain it to them and tell them. Some people, they didn't really notice it much because I never talked with my mouth open. So I guess I hid it very well, so they could never see. So now they're just really excited for me. They see that more of the confidence and the boost that it's given to my self-esteem, and they're just really happy to see that change in me, and yeah.
Good. How was the procedure itself? It took about, an hour?
It was about an hour, yeah. And it wasn't too bad.
Was your comfort level was it easier than you expected?
Yeah, I was expecting more pain or sawing in my mouth or, something.
Your comfort level afterwards was pretty good?
It was fine, yeah.
Any adaptations you had to go through with talking or speaking or hearing?
At first it was just kind of different because I was used to having the crooked, so I could feel it in there, and to have just a smooth way to talk and stuff was a lot different. So it kind of, I had to adjust and kind of feel around in there a little bit. But it was fine. For the first couple of days, though, I didn't want it biting into anything hard or, have anything, there just in case, and it was a little sensitive, but not too bad, not anything, really major to worry about.
Overall, it's been a pretty positive procedure.
Oh my gosh, yeah, it was totally worth it.
If you could have done it earlier, what held you back from getting it done before?
My financial, and I was really scared because, over the years, everyone told me if you did this, it might fall out, this might happen, blah, 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 and it deterred me from it a lot.
Had you ever asked about having it done in another office or at other dental offices beforehand?
Well, yeah, when I lived in California, I had asked and stuff, and, they gave me all these things of, what could happen, what couldn't happen, what could be done, what couldn't be done, but no one ever came to me and said you could just do a composite veneer and have it fixed. That was never a solution for anyone,
So what they were suggesting before was the actual crown, probably.
It was either a crown or pulling it and doing different things with it that way, or implant or however, but never just taking what I had and building from it. Yeah.
Well, we appreciate you sharing that with us, so I'm glad that it's been a positive impact in your life.
It's been a big impact.
Thank you very much for your time. We're glad that it's made you happy.
Well, thank you very much.